as you all know by now, the Reach Out Stronger Practice Hub team are made up of, or is made up from Damon, Victoria, Jess and Lisa. We've got Damon and Lisa here tonight, so thank you to you guys for coming along. As you probably all know by now, the Stronger Practice Hubs support our early year settings to improve outcomes. There are 18 Stronger Practice Hubs across the UK, and our one is based at the Barn Nursery School at Grinstead Green. So the Stronger Practice Hubs are funded by the DFE as part of the Early Years Education COVID-19 recovery. And it's proving an invaluable source of support for a lot of practitioners. This is for you to look at a little bit later, but depending where you are in your career path, you can access lots of different things from the hub. And common to all of us is the Early Years Evidence Store. Now, this is an online resource where you can look at all sorts of evidence for your practice, not just speech, language and communication, but lots and lots and lots of different facets of the early years foundation stages. So if you're wondering whether what you're doing is matching up with the current evidence base, whether you've been a practitioner for a long time and you just want to make sure that what you're doing is currently supported by the evidence, go and check it out. If you're new and you're not sure, go and have a look as well. It's suitable for lots and lots of different practitioners. The Stronger Practice Hub can also offer lots of different fully funded courses, a couple of which are outlined here, as well as providing bespoke support. So if you see, have a little look and you think, well, that's not quite what I want, please do get in touch with one of the Stronger Practice Hub team members, and they can see what they can put together for your particular setting, because we know it's very not a one size fits all, is it? So please do reach out to them. Lots and lots of training dates and information are available on Instagram, so do go and have a look. Very active on there. So into the bit you're all here for. So across the next 2 webinars, there's several aims and there's lots, but don't panic, we'll walk you through it. So I want to think about neurodiversity. What does it mean, first and foremost? Neurodiversity affirming practice. And then this is more for the next session. What is echolalia? What is analytic and gestalt language processing? How can I identify gestalt language processor and what should I do? But today is really thinking in more general terms about neurodiversity and neurodivergent. It's in your setting. And a lot of the things I talk about, obviously, because we're early years practitioners, are going to be with our smaller people in mind, but actually a lot of this is transferable to your neurodivergent adults as well. So if you work with colleagues who are neurodiverse as well, do have those people in the back of your mind also. So what is neurodiversity? Neurodiversity is a lot of different things. I think the ones that we kind of naturally spring to are your kind of autism spectrum disorder, your anxiety and ADHD. Certainly I spring to those first because my eldest daughter has been diagnosed with ADHD and anxiety. So I'm very, very hot on those. But it's also things like dyspraxia, DLD, which is developmental language disorder, OCD, auditory processing issues. And what I really, really like about this slide is the fact that in this top corner, we have undiagnosed, because we know that the path to a diagnostic appointment can sometimes take a long time. Even if as practitioners or parents, we absolutely know that there's a neurodiversity happening, you know, we shouldn't be afraid to put those strategies in place while we wait for a diagnosis. So I really like the fact that this slide recognises that too. Now, AJ's Brain is an absolutely fantastic account that you should go and have a look at on Facebook and Instagram. So I did get permission from AJ to use some of their slides. And And I think it's really useful just to have a look at the definitions to make sure that we're using them, the correct terms in the correct way, sympathetically and appropriately. So neurodiversity really basically is just the natural diversity in brains. So, everyone is neurodiverse. It's the way we experience and process the world. But people who have a different brain or neurotypes, the majority are classed as people who are neurodivergent. Neurotypical people are those who are not neurodivergent. So they're often considered to be, the normal brain. But that really is just because it's the most common. But what you will see is perhaps the abbreviations NT and ND, so neurotypical and neurodivergent. Neuroaffirming is embracing and celebrating strengths and abilities of neurodivergent brains rather than attempting to fix them. And, I think I spoke about this in Chelmsford. A lot of the things I did when I first started practicing, I would never do now. So when I started practicing sort of 20 years ago, a lot of the things that we did with our neurodivergent children were very much trying to turn them into a neurotypical child, or request that they communicate in a neurotypical way. And that very much is changing now into a more neuro-affirming approach, where we are kind of embracing how a child communicates rather than trying to change it. And that's really important and very core to all the things we're going to be thinking about today. So the neurodiversity paradigm linked to that is basically recognizing that different neurotypes are natural and they're an essential part of a successful, diverse society. And actually, there's research coming out now that, different neurodivergences back in the sort of time of the caveman were useful. So you had your kind of ADHD hunter-gatherers who were the ones who were always on the go, and that was kind of a celebrated characteristic to have. So it goes way back if you read about it. So what is neurodiversity affirming practice, and how can we sort of tune into that in our setting? So strength-based language versus deficit-based language, and I've got a really good Instagram video to show you hopefully about that in a moment. Presume competence. We should always presume that a child can rather than a child can't. And it can be a very difficult switch to make, but we should always be trying to do that. Accessibility. All communication is valid. Listen to neurodivergent voices and promote autonomy and tailor support to individual needs. So I'm going to go through a lot of this in a bit. So what is accessibility? Now, if we found out that we were to be welcoming a wheelchair user to our setting, whatever your setting may be, I think there would probably be a quick look around at door widths, ramps, steps, anything that could get in the way of this person's ability to access the setting. You'd provide a ramp, or you'd provide some form of accessibility for that person. So what could our ramp look like for a neurodivergent child in our setting? Any or all of these. Don't feel that you have to put every single thing in, because again, you're tailoring your input to the individual needs. Sensory breaks, quiet space, visual supports. Now, sensory breaks, I think a lot of people think that they need to have a sensory room or some kind of really fancy space for a child to go. Whereas actually it can be quite as simple, depending on the size of your setting, of taking them out of the main room to go and do a bit of photocopying with you. Something where you're away from all that hustle and bustle. It doesn't have to be a big break, just a move away from that busy setting. Visual supports, flexible seating like a stability ball, maybe a cushion or an own blanket. So again, I've had it in therapy sessions where a child has kind of brought their own chair or brought their own cushion to sit on. It's absolutely fine. Noise reduction, visual stimuli reduction, sensory tools, support with transition, routines. Any of these things could and should be considered if you have a neurodivergent child in your setting. Choose your words. Now, this is really important in meetings, particularly where often we can focus very much on a child's difficulties. But if we think about how to change those words, it's quite powerful. I'm going to show you a video about that in a second. But Temple Grandin, so this is probably, Temple Grandin is almost like the authority on autism spectrum disorder. You may well have heard of her. And I think this quote rings quite true. There needs to be a lot more emphasis on what a child can do instead of what they cannot do. And at this point, I'm just going to stop sharing my slides and take you into my Instagram, which hopefully, here we go. Have a little listen to this. I hope you can hear it. It's only a couple of minutes long. If you can't for any reason, let me know.
Looks like some of the noted behaviors here are that Jack runs around and he does not sit still in class. Some observations I made about Jack, looks like he's a whole body learner and he does very well in environments that incorporate movement and hands-on activities. Yeah, and some other behaviors that I noted were that Jack only talks about his interest and he tends to perseverate on Bluey. I noticed that he really connects with others when talking about the things that he loves to talk about. And when provided with some visual supports, it really helps those transitions and navigating between activities. Yeah, and then the other thing I wanted to talk about was that he's non-compliant and refuses to participate in large group activities. I also noticed that large group activities and large group settings can tend to be a little bit overwhelming, but if there's access to quiet space, that really helps reduce that sensory overload.
Okay, I hope that worked for you and that you could hear that okay. I found that a really powerful video when I first saw it on Instagram, and I thought it was excellent. Because I think it really does show how just that shift in language can make a meeting a lot less threatening for parents as well. So I've seen many parents come out of like review meetings in tears because it's been about what their child can't do. If we can think about what they can do and just try and acknowledge the difficulties, but reframe them, I think it's something that takes time. So do just, give yourself some grace. It will take time, but you'll get there. So neuroaffirming language, I think it's really useful at this point just to have a think about what we can't, the terms that we're currently using. These things fall in and out of favor a lot, but currently, instead of autism spectrum disorder, we're just saying autism or autistic. Instead of high or low functioning, we are now saying high or low support needs. Instead of saying a normal person, we're now saying a neurotypical person or an allistic person or a non-autistic person. So again, these are things that you might not necessarily use particularly in your setting, but you may well have them in reports. So it's good to know what they are. And again, instead of person with autism, we're now just using autistic person. Instead of a comorbidity, so something that occurs with the neurodivergence, we're saying co-occurring. Instead of symptoms, we're saying traits. Deficits have now become differences, and non-verbal has now become non-speaking, because these children do have something to say. They just don't always say it verbally. Just a really quick one on the use of the puzzle piece symbol, which you may have seen before. That has now been replaced with the infinity symbol. So don't use puzzle pieces. So that has now become quite an offensive symbol in the neurodiversity world. So it does imply that autistic people are incomplete, or there's problems to be fixed, and it's untrue and harmful. So instead of a puzzle piece, we are now using the rainbow infinity. You may also see the infinity symbol in gold, and that is more specific to autism, because AU is the chemical symbol for gold. So particularly autism awareness is a gold infinity symbol, and the rainbow infinity symbol is used for kind of all neurodiversity. Now, the autism cake metaphor. This works really well in person. So in Chelmsford, I gave everybody 2 cakes, which was a high point, I think. It was a mid-morning sugar rush that I think was needed. I want you to have a look at these 2 cakes and just take a moment to reflect for me. This is the sort of thing, if you were with people, I would get you to have a chat about it. But I want you to I want you to have a little reflect and a little think about which of these cakes is more of a cake than the other cake. Which cake is more cake than the other cake? Is any cake, either of these cakes, particularly cakier than the other cake? Does one fit your definition of cake more than the other one? Which one is more cakey? Think about other cakes that you like. Which one of those is more cakey? And actually, when we were talking about this in Chelmsford, there were an awful lot of cake-based discussions, actually, with people talking about all the different kinds of ingredients, whether they might be gluten-free, how long they were baked for, all sorts of things. Now, this works less well on a webinar, but so I'm going to have a go straight onto this. So Magpie in the Hat illustrates this beautifully, and you should go and check out their Instagram account as well. So we need to start thinking of autism and neurodiversity like it was a batch of cupcakes. So some of them, or different cakes, some of them have sprinkles, some of them have fruits. They all have different ingredients. They're all different flavors, but they are all still cakes. And I really like this tweet from C.L. Lynch here that said, imagine if autism was described like types of cupcake or cake. You have some with icing, some with sprinkles, some chocolate, some vanilla, but they're all cupcakes. And someone goes, yeah, but how cupcake is it? What? Like, is it a little bit cupcake or severely cupcake? Doesn't work like that. And it doesn't work like that for autism either. And I think that's a really strong thing to reflect on. The autism spectrum is not, as we used to think, a linear scale of high functioning down to low functioning. Rather, it is a very, very multifaceted profile looking at things like executive functioning skills, sensory sensitivities, emotional regulation, social differences, communication, perceptions, repetitions, interests, and all those other things. And you end up with a profile that looks like the bottom one rather than a high versus low. And we really need to move away from this top one now, because autism is not like that at all. And I think this quotation is hugely powerful from Adam Walton. So so-called mild autism doesn't mean one experiences autism mildly. It means you experience their autism mildly. You may not know how hard they've had to work to get to the level they are. So I think we've all probably now heard of children and young people who mask, who spend the whole day trying to fit in at nursery or school and then come home and drop the mask because they have been working so very hard to fit into the neurotypical box. And I think, again, we need to recognize that. And the earlier we can start embracing neurodiversity and start using neuro-affirming practice, the less we should see that and that huge mental health load that we're seeing in our kind of adolescence. I also really like this quotation from Dr. Stephen Shaw. If you've met one person with autism, you've met one person with autism. It's so, so multifactorial that really one size does not fit all. The other thing to think about is that we are now using person first language, okay, rather than identity first. No, sorry, wrong way around. We are using identity first language. So autism isn't something that we have, it's who we are. So we're now saying autistic person. So different people may have different preferences. And this is something, because my clinical specialty has always been deafness. We've also had this in terms of deafness, whether you use the term deaf or hearing impaired or hard of hearing. And again, these things can ebb and flow, but it's really important to listen to the voices of neurodivergent young people and adults on this one. Eye contact. This is something that I really, really want to hone in on for a moment, because I know that there are still a significant number of professionals who are encouraging eye contact goals for our neurodivergent kiddies. I just want to have a think about that. So I expect we have all been advised to work on eye contact with children who make it minimally. And in some cases, as I've just said, this is still the current advice, but there is now a move away from this. And I want to think about why that change is happening. So a little bit of history. In 1949, Leo Kanner first described Kanner syndrome, which was the foundation for what became known as autism in the 1970s. So we're still quite early in the field of autism and neurodivergence. And it's only now that we're seeing those autistic children growing up and becoming neurodivergent adults who are starting to tell us how they feel about the interventions they received as children. So particularly, well, the first book here, Dirty Laundry, that is actually looking at ADHD, but it's really a very, very good read. And again, these guys have got an Instagram account, which is incredibly insightful. So The Reason I Jump is an absolutely phenomenal book. It's very quick to read as well. It's a very small book. I've got it on my bookshelf just up there, actually. It's thin and it's not too difficult. I really would recommend that you read that one. A Different Sort of Normal is also an excellent book. And then I think the front cover of the last one actually really does speak volumes. So Look Me in the Eye, My Life with Asperger's. And again, Asperger's is now a term that we're not using anymore because of some historical findings about Dr. Asperger, which you can Google later if you want. But again, that Asperger's is now really just being called autism also. So please try and move away from that term if you can. As I say, have a little Google about why we don't use it anymore. This comic strip I thought was really, really excellent, thinking about eye contact. So for allistic people, so that are non-autistic people, eye contact is a way of connecting with others in conversation. But for autistic people, it's really different. It's uncomfortable and it's invasive. So when we're looking away, it doesn't mean that we're not listening. It doesn't mean that they're not just, people with autism, autistic people aren't disrespecting you. But I think if they are trying to make contact with people, it can totally distract from what is being said. Because actually, I think I'm guilty of doing this in my practice up until relatively recently, actually, of saying, you need to make eye contact with people to connect. And actually, you end up with a kind of very unnatural stare because young autistic people don't know, have they looked too much? Are they doing it right? It makes them feel vulnerable. They can't do it. And as soon as all these thoughts are going around, actually, they're not listening anyway. Many autistic people fake it by looking maybe at a mouth or glasses, or I used to teach the kind of triangle, so you can sort of have a look sort of anywhere around here that isn't the eyes. But for others, even that's too much. So actually, I think this bottom slide is really, really important. When an allistic person demands eye contact from an autistic person, they're asking for something that only benefits them. So why should an autistic person experience discomfort for you? And I think that's really, really interesting. And actually, the following slide also sort of backs this up. So eye contact is not necessary for listening or paying attention. Many autistic people find it easier to listen and process auditory information when we don't have to process visual information. Forced eye contact for the sake of appearing normal can be challenging, tiring, and painful. We avoid it for a reason, respect that. So certainly for your more school-age children, there is now a move with our neurodivergent children to allow them to perhaps even doodle while they're in class or having a conversation. And certainly that works for my daughter who has ADHD. If she's allowed to just sort of doodle, she can concentrate more easily on what's coming in auditorily, because she's not having to process all of the visual information as well. Autism and changing classroom strategies. Now, this is one of those slides that you should probably go and have a read of when you get the slides. But basically, it says here, requiring children to look at you when you're speaking to them. For most children, this allows them to better attend to what you're saying, because the act of looking while listening often gives you their undivided attention. But for many autistic children, looking at people speaking to them is problematic. Many autistic people will tell you eye contact is painful. And even when it's not downright painful, eye contact can be a problem for many autistics in that the information picked up is too intense, which can trigger shutdown. Whether painful or too intense eye contact with an adult speaking to an autistic child will not ensure that child's undivided attention. In fact, demanding eye contact of an autistic will most likely be counterproductive to your goal of having them take in the information you're saying to them. So I know, certainly I remember, you know, the days where I was sitting there with a post box and some letters, and it was look at me, look at me, look at me, look at me before I would give them the letter to post. And, you know, we do what we can with the evidence we have at the time. And at the time, that was the evidence. But this is why it's so important to keep up with our evidence base, because actually this is key. So please, please, if anybody suggests that you work on some eye contact goals, you by all means, please do take out these slides from this presentation and have, you know, a gentle challenge of whether that is the most appropriate thing to work on with your child, because I can, you know, I can guarantee there will be something else that's going to give you a lot more functional benefit than working on eye contact. So that's really the underpinnings of neurodiversity. Coming up in September, I think, is the one that everybody really, really wants, which is the introduction to Gestalt language processing. So these are these children who are echolalic, children who are speaking in scripts, children who are talking in full sentences or phrases, but it just doesn't make any sense. The words are there, you can hear the words, you know what they're saying, but why are they saying it? Why are they repeating a chunk from a book? Why are they repeating a chunk from Hey Dougie? What does it mean? And what do I do with them? And that's for next time. But I think those of you who have been to my talks before know that I like to do a little bit of theory before we get to the practice, because that way you